We're entering a new era of cancer therapy. Thank goodness, because I think we'll look back on where we've been and see it as the dark ages, where we're giving people poisonous chemotherapeutic drugs and radiation and cutting organs out that have tumors. And, obviously this was the best that we had available, at least that Western medicine had available. And, it did save some lives, but this is what is coming. We've entered the era of immunotherapy. What we've learned is that cancer, one of the reasons why it can really get a foothold in the body is that it has ways of evading the immune system. So now there are therapies that will disrupt like a tumor microenvironment and kind of overcome the shielding that cancer normally has to evade the immune system. Then that will expose the cancer antigens to the immune system and will promote a body-wide immune response against that cancer. And now we also have medications called checkpoint inhibitors that block this immune evading mechanism that cancer cells have. And so you can combine agents now and produce really good results. So for example, there's a person down in Southern California that is conducting studies currently where he is injecting tumors with a probe that is cryotherapy, and he's freezing the internal part of a tumor, which kills the cells and exposes the antigens. And he also injects something that's like an immune stimulator. So it's basically an extract of strep bacteria that has been shown to activate the immune system without causing an infection. And then working in combination with checkpoint inhibitors, which block that immune evading mechanisms that cancer cells have. He's been able to treat metastatic prostate cancer in men and metastatic breast cancer in women. And I don't know if many of you know this, but one of the things that I do is I am the chief medical officer of a company called Immunocore. And we actually are doing really exciting research where we are working with two proprietary viruses that we inherited from Dr. Anton Mayer, who was the person who developed the world's last smallpox vaccine that wiped smallpox off the face of the earth. And the viruses we're working with, one of them we are using as an oncolytic virus, and we have found that it will kill 100% of pancreatic cancer cells in 6 different pancreatic cancer cell lines. And we have also found that it kills gastric cancer, triple negative breast cancer, head and neck cancers, and we are moving into working on glioblastoma. So one of our other viruses is a potent immune stimulator. We are thinking about working with them together. I think that this model that I discussed initially is really kind of laying the groundwork for combo agents used together, approved as one unit that do different things. And we are going to be able to really move the needle with cancer moving forward because we're harnessing the innate intelligence of the body to go after this. And we're just working to overcome these evading mechanisms that cancers have evolved to have. When we bring the best of integrative medicine to bear on top of it, where we're creating an anti-cancer milieu in the body at the same time, I think we can really move into an era where cancer is no longer so scary and it will become a thing that's easier to treat.